Okay, the county healthcare services in Pasadena are not nearly enough to serve the fast-growing population in our area who need it. Many of us wait months and months to get an appointment to see a doctor. The CEO of the Harris County Hospital District, David Lopez, committed that there was enough money in the budget to build additional satellite health clinics to serve our community. What will you do to ensure that these clinics are built quickly and with a determined deadline? What will you do to extend the hours and numbers of doctors at Strawberry Clinic to service more people right away?
I've had a chance to visit with David Lopez about this issue. We're looking at a master plan for the county of primary, secondary, and tertiary care. In other words, if we can do it at a clinic, we'll do it at a clinic. If we need to go to a hospital for major surgery, do it at a hospital. So what we're trying to do is look at all of the clinics and working with different organizations, whether it be the Chinese community, the Hispanic community, the African American community, to have clinics closer to people and work on their needs in particular. So, what are we going to do? You know, we have a Healthcare Reform Act that kicks in 2014. I'm sorry, this is a long answer. And we're going to have more people that are not uninsured. They can go to clinics. We want to make sure that we have a network in place, close to people, and looking at a map to make sure that not only the west side, but the east side as well is fully funded with clinics. So I hope that answers your question. The answer is collaborate with community organizations like the Strawberry Clinic to make sure that we have coverage throughout the county, and especially in areas that are underserved.
One of Judge Emmett's chief duties is healthcare in Harris County. And one of the things that he's been doing since he became county judge is he wants to create what he feels is a more regionalized healthcare system. In fact, this is one of the judge and his wife Gwen's biggest issues is healthcare and expanding the number of FQHCs, or federally qualified health clinics, in Harris County. We have 4 million people in Harris County, and we have 13 or 14 federally qualified health clinics, whereas Cook County, Illinois, which is another very, very large urban county, has almost 83 of them. What that does for us is that, say, you know, you get sick, or your child gets sick, or breaks an arm. Typically what you do is you go to the emergency room downtown, Ben Taub, or one of the other large hospitals. Well, not only is that time consuming, because you sit in the waiting room for 4, 5, 6, sometimes 10 hours and wait and wait and wait, and it does you no good, and it does your child no good, or whoever's sick. But not only that, it's incredibly expensive to go to an emergency room. Whereas if you go to a federally qualified health clinic, it'll cost you maybe $75, maybe $100, versus $300 to $400 to $500, or even $1,000 at an ER. So what that does, it not only it breaks up the healthcare system to where you have more regionalized care in your area in a federally qualified health clinic like the Pasadena Care, or the Centro de Corazon, which is over on the east side of Houston. We need to have more of the FQHCs because it makes it more affordable, and it makes it more readily available for you all for health care. The county population is going to grow over the year, and we need to have more of those. Judge Emmett is going to work closely with the Harris County Hospital District and also the state and federal authorities to make sure that we get the money to expand those FQHCs into all regions of Harris County, not only just Harris County, but make it a more regionalized healthcare system. So that, say, if you move to Brazoria County or Galveston County or Fort Bend or Waller County, you'll have the ability to go to one of those FQHCs and not pay a different rate than if you were only in Harris County. So Judge Emmett is very, very aware of that and working on that.